everybody. Andy Bassett here with Ellerbrock-Norris. Happy to share some information with you specific to a topic we actually discussed the last time I did one of these, which was litigation around COVID-19. And we talked at that time about some of the federal legislation that was in the works that really hasn't come to fruition, that was going to provide some protections for businesses, small businesses, if they would potentially get sued for the alleged contraction of COVID-19 by people patronizing their businesses. Well, fast forward, or in that conversation, one of the things we had talked about was potentially things happening at the state level. And so I want to fast forward to today, where we are actually seeing some things specific in Nebraska, but across a lot of states in the United States that are doing things to address this issue at the state level. And so in Nebraska, as an example, there's actually two bills that are in front of the unicameral during this session right now, and that's LB 52 and LB 139. And it's interesting, LB 52 is kind of really broad, that basically just says something to the effect of it's going to limit the ability or protect businesses for the litigation or the liability I just discussed. But LB 139 kind of dives in and defines it a little bit better, and it follows a lot of what the federal legislation was designed to address potentially. And so just a couple highlights. It would provide premise liability protection so long as the person is not engaging in gross negligence or willful misconduct. That's important because it's saying, look, we're not telling people that they won't potentially be able to sue for the contraction of COVID-19 while patronizing a business, but they're going to have to prove that that business was in fact grossly negligent or willfully engaged in willful misconduct, which is a big deal because that now allows us as businesses, as long as we're doing the right things, to feel we have protection against those types of liabilities that may exist, or that type of litigation. It goes on further to say that it would provide safe harbor for people for those persons following public health guidance. So if we're following all of the state and federal guidance that we're receiving from CDC or from local governments that require us as businesses to do certain things, as long as we're doing that, we're probably pretty protected against that type of litigation. It also specifically addresses healthcare providers and facilities to address, that they have oftentimes different guidelines and regulations that they're following. So that's addressed in there as well. So I think it's a really nice step forward to see states doing these things. And since from a federal perspective, we didn't see a lot of traction. So again, in the state of Nebraska, that's LB 52 and 139. We're going to certainly keep a close eye on those and hopefully bring more education as we see those develop. It's early on. Legislature just got back in session, but it's good to see that happening. One other thing I think too, that while we're on bills and we're talking about COVID-19, there is another bill, 441, in the state legislature that's interesting right now, and it is addressing workers' compensation, where if an employee would get or perceive to have gotten COVID-19 in and out of the course of employment, historically, the courts have always perceived that the illnesses of daily life and things of that nature, cold, flu, or whatever, oftentimes the presumption is those were actually not contracted in and out of the course of employment, and the burden falls on that employee to prove that they were. LB 441 is going to change that potentially a little bit, specific to essential workers. So it would flip that and say, look, if an essential worker does in fact contract COVID-19, the assumption is that they did get it at work, and the employer would actually have the burden of proof of proving otherwise. And it's interesting, really quickly, some things that qualify as essential worker. It's pretty broad. Ambulance operation, medical care facilities, emergency room, assisted living, hospice, hospitals, home health care, adult day service, nurses, physicians, physician assistants, pharmacists, those things, firefighters, people working in food processing, meat packing plants specifically. So that's interesting. Public and private school employees, teachers, things of that nature, grocery store, truck driver, child care employees. So pretty long list, but needless to say, there is some stuff going on at the state level that is designed to address some of the questions that are out there specific to COVID-19 right now. We, of course, want to bring that to your guys' attention so that you know, and you can go out to the Nebraska legislature site, you can read about the bills, educate yourself. Certainly reach out to our team, any advisor on our team, to ask any questions and gain as much knowledge as you can. But we're going to keep watching this stuff for you and keep the education going. At that, thanks for listening, everybody.